Welcome back. I'm Tim Erlander with the Republican Roundtable with you once again, and it's good to be back. And it's good to have Mark Sullivan.
Yes, good to be back with you again, Tim. How you been?
Good having you once again. And we have our special guest, Matt Dean. Matt is a state representative from District 38, which includes basically White Bear Lake. And he's also a chair of a rather important committee in the Minnesota House of Representatives. And Matt, why don't you just tell us the full title of that committee?
Sure. Well, first of all, thank you for having me today to talk a little bit about an important issue in healthcare. I do chair the Health and Human Services Finance Committee, which has jurisdiction over all of our state healthcare programs as well as our public service programs. So anything that touches folks through the county or through hospitals and healthcare, and touches about 1 million people directly just with Medicaid, and indirectly everybody else in the state because we all receive health care in one way, shape, or form.
One way or another, yes.
Yep.
We're not going to get away from that, are we?
No.
Now, everybody, I think, now knows that Minnesota has cratered with regard to Obamacare, and we've joined a rather long list of states that have done the same thing. What has this meant for us?
Minnesota has always led the nation in health care. We've had the highest quality and, generally speaking, some of the lowest costs.
Well, they said they kind of patterned some of Obamacare off of MNSure, or old MNSure.
Well, if we had the goals of Obamacare, we met 10 years ago. In terms of the number of insured we had a program for people who were difficult to insure because of pre-existing conditions, so that nobody had to go without insurance in the state of Minnesota. That was on a sliding scale, so you pay what you could afford. But if you had cancer, you had a heart attack or diabetes, that you could get high risk health insurance through the state. We also had a program for people who were low income. We had a program for individuals who were very low income. So we kind of took care of our own in Minnesota, and we did a very good job.
Generally, if you needed insurance, there was a place where you could find insurance.
And if you couldn't afford it, the state would help you out with that. If you had no or low income,
I know a number of people
that
got quite a bit of aid through in fact, they were doing a lot better off back then than they are with the program now.
Well, and people said, well, it wasn't perfect before, but everybody could get care. You had generally a choice of health insurance programs, and if you had a small business, you could, generally speaking, shop and purchase a plan if you've had less than 50 employees. Today, middle-class Minnesota is in a vice. If you're trying to purchase health insurance on the exchange, if you're trying to just go out and buy it, if you talk to an insurance agent, you can't do it. If you might have a choice of one plan, you might be a truck driver making $26 an hour, and the only health insurance that you can get is $13 an hour. That don't work. We also have a system right now where the insurance companies can compete, and they aren't able to offer products to all of Minnesota, and they're capping how many people they can cover, and that doesn't work. So even if you can afford it to buy a policy, even if you're lucky enough to find one, you might have a choice of one, and the hospital that is in your town might not be in that network, and you might not be able to see your doctor.
I think maybe we should kind of back up just a bit for the people out there who maybe aren't really up on exactly what's happening with the health insurance, but a lot of the providers, especially in the MNSure portion, have dropped out. There's only a limited number of providers left, am I correct?
Yes, and if you remember the Affordable Care Act,
right,
or as Governor Dayton calls it now, the Unaffordable Care Act.
All the promises we had of, okay, you get to keep your own doctor, you keep your insurance, it's going to cost less, and you're going to get more.
Yeah. So just to kind of review, if you like your plan, you can keep your plan. If you like your doctor, you can keep your doctor, and it's going to save $2,500 a year per family.
Okay.
Well, let's see how your plan went. 140,000 people checked off their plans immediately. Basically, the individual market is gone in the state of Minnesota. And your doctor, if he's not affiliated with a plan or she is not affiliated with a plan, if she's out of network, you're out of luck. So that you might have a back surgeon in Stillwater, your doctor might be in Stillwater, but your plan might be somewhere else where you can't go to the areas closest to you. Also, there's the choices. You know, Obamacare said we want to have 5 choices for everyone. Mm-hmm. If you live in greater Minnesota, you're going to have Blue Cross Blue Shield has a plan called Blue Plus. That has very narrow networks, meaning that you're probably not going to be able to see who you want to see. And that's your choice. It's that or Medica. Medica has 7,000 slots they can sell statewide under the approved plan. Once those are gone, they're gone. So you're trying to reshuffle an entire healthcare system in particularly greater Minnesota, where you're just not going to have access to the physicians, the doctors, the hospitals, and the clinics that you're going to need. That's going to be a big problem. So people right now are getting in the mail letters from their insurance company, and the letter is going to say you're going to have to go into open enrollment and get a new plan. You lost your plan again. You probably lost it a couple years ago. You're losing it again. You're going to have to go in. I talked to a woman who has a son who has 2 brain tumors. He's 12 years old. And he receives treatment at the Mayo Clinic. And he has a very complicated treatment regime he's got two lesions, and they're being treated with radiation. And they affect how he sees and how he hears. So he's got an ophthalmologist, an audiologist, an otorhinolaryngologist, an oncologist, and lots of other great ologists that we have down there. But that's his care team.
I'm surprised he could even pronounce that, let alone...
That's his care team. But they get a letter saying that he can't go to the Mayo Clinic anymore because it's not an option. So greater Minnesota, if you have cancer, you should probably go to the University of Minnesota or Mayo for treatment if you have a difficult situation. You're not going to be able to go and stay in network. That means it's not a possibility for families. So what does this mom do?
You're not going to be able to get your specialized treatment that you need and that is available.
Well, in Minnesota, that we should be able to get there. And this little guy has a tough road ahead, and he can't get there. So he's going to be out of network. So he's going to be out of luck. So she says, "Well, I can get divorced. We can quit our jobs, or I can rob a bank, and I'm going to do whatever I need to do to get my kid the care that he needs,
or move." I suppose.
And that's just where the situation is, and that's not okay. And so that's why I really think that once people really understand what's in front of us, they're going to understand that this proposal that the governor has approved on the table right now doesn't work. I think the governor knows it doesn't work, and he knows that we're going to have to come in for another session.
The proposal was to keep these insurers in the program to begin with. They wanted to drop out, am I correct?
Well, if you remember, if we go back in the Wayback Machine a year or two,
I really try hard not to, but I still do.
The Commerce Commissioner was crowing about having the lowest insurance rates in the country, and we're the best because we've got these really low rates. Well, our plans in Minnesota, Preferred One, Blue Cross Blue Shield, Medica, and Blue Health Partners, all were really forced into providing a lower premium. Well, what happened? Preferred One got out of the market. They had to pull out.
Well, I mean, they're required to cover the whole broad range of situations that normally most people, most people may not even make a claim on or get, but and in some cases really aren't, as far as I'm concerned, health-related situations, but they are required by law to cover all these situations. So the insurance coverage is very broad for what they have to cover, which means it's a higher expense for the insurance company.
And if you compare Minnesota to other states, we have more mandates than just about any other state. We're the state with 10,000 mandates. And that makes it more expensive to write insurance here. We also had that high risk pool for people who are uninsurable. That's now in the private market. So that's a sicker pool. So that drives up the cost. We also are the one state with 3 public programs. We've got Medicaid for the very poor. We've got Minnesota Care. And then we've got subsidized private health insurance policies. So we've got 3 ways to do it. Every other state in the country has 2 ways to do it. So that makes our pool even smaller. That drives up the price even more.
And considering the fact they can't get their software together on the MNSure.
That's another story. But just from the insurance standpoint.
It's another show.
Yeah, that's another show. But just from the insurance standpoint, that's why the pools are smaller and the prices are higher and the mandates are bigger. So we lost our smallest provider in Preferred One last time. Now we lost our biggest provider in Blue Cross Blue Shield. And so Minnesotans are left holding the bag. And you've got middle class people with $1,000 a month premiums and $12,000 a year deductibles. So that's $24,000 before you receive a dime's worth of health care. That's not health insurance, that's bankruptcy insurance. Yeah. And that's not an expensive policy for a family of 3 or 4. That's probably moderate. And then you get into folks who have maybe some health issues or some things that drive that up. And then you're having middle class people with more than a full-time job going to health care. It's higher than their mortgage, it's higher than their child care bill, and you simply can't have that. It's not sustainable. So we're going to have to do something new. And then we've got the price on one side, but then we've got access on the other, where we have people in greater Minnesota who are going to have to drive 60 miles to go to the doctor, and they might drive by 2 hospitals and clinics on the way.
Right. Well, I think part of the agreement that Governor Dayton is arranging with these providers is that there's a cap on the number of people that they can sign up. And this is something the providers wanted. They didn't want to get too big a risk, if I'm not mistaken. Am I correct?
Correct.
By having too many customers.
Sure.
And
well, we've got a mandate in Minnesota.
So, as each one fills out, say 7,000 with this one, 5,000 with this one, whatever their peaks are, that's that first come first serve, and whatever is left over, well, depends on where you are on the line.
So we've got caps from the numbers, and then we've got geographic boundaries. So Health Partners said, we're going to do the metro area and 2 counties in St. Cloud. And then other providers said, we're going to cap the total number of people that we have coming in, both of which limit the exposure. Mm-hmm. However, if you're a doctor in Minnesota and somebody has a car accident and they come to you, you have to treat them. That's the federal law. Mm-hmm. And in Minnesota, we have, obviously, if you're low income, you can go anywhere and get care. Basically, no premium and no deductible. So that's a mandate for care. Mm-hmm. So now we're saying that if you're middle class Minnesota, you can get rationed. And I don't know why that's appropriate, legal, good, or advisable. I don't think it is. So you can say, you can come to Minnesota from another state or another country if you're eligible because you're low income on day one, no premium, no deductible. You can go to the Mayo Clinic, you can go to the University of Minnesota, you can go wherever you like for care and get care immediately for no premium, no deductible. Right. If you're 53 years old, you've lived in Minnesota your whole life, you've paid your bills, you've played by the rules, you've never missed an insurance premium, you might have $1,000 a month premium, $1,000 a month deductible, and you might get crushed on top of that with a 50, 67% increase this year. Yeah. So and your doctor's out of network. You throw up your hands and you think, is that really fair?
Well, so some of these people are going to be spending, there's one case I can't believe Delt was talking about, up to $54,000 a year before a dime of insurance is paid between premiums and deductibles.
And that's not unusual, unfortunately. We've got members with people coming on their doorsteps, grown, proud men literally crying, saying, I'm going to lose my house. I don't know what to do. I pay my bills, I play by the rules, this doesn't work.
They're paying more than they are for their mortgage.
Absolutely, absolutely. You know,
This is kind of a horror story. I'm nice and safe. I'm on Medicare, and I got a decent Medicare supplement because my wife's insurance was able to turn over and become a, what do you call it, a supplement. And so
But
I'm
even
in-
with Medicare, you wind up paying 20% on that. So,
I
mean, you know.
haven't yet. So far, I feel like I'm safe, but I have a funny feeling that that's not going to last forever.
no, Medicare premiums are going up for supplemental coverage. And also the formularies for the covered drugs are going to be compressed.
That I've noticed.
So, if your medication used to be covered, it might be covered less or not at all. So you see the list of drugs that are no longer going to be covered might look like the drugs that you see advertised when you're watching a show that maybe senior citizens watch, and you think, hey, there might be a coincidence there. So that's really where that is getting pushed. But it's a very big deal for not just for retirees, but for people who want to retire. Maybe you can retire a little bit early, let's say 57 or 60, and then you think, well, I've got a couple of years to get through until I'm on Medicare, that I can be on my work plan. Those are the first ones to go. Those are dropping off, and then people are finding themselves into the market. And if you're a farmer, you don't have a large company or a union or whatever to protect you, you're in that individual market, you're getting slammed. If you're a small business owner, you're getting slammed. So it's the people who are out there who are, trying to buy their own insurance. And if you just think about the pure numbers of it, the governor says, well, that's going to have to wait until after the election because we don't want this to become a political issue.
Oh, sure they don't.
As if
It wasn't.
Yeah, something
Starting
that
to
was.
sound like you gotta vote for it in order to find out what's in it.
Oh yeah, there's nothing political about MNSure or Obamacare. Something that's just run by people with political science degrees, from top to bottom. But he's saying, we can't have a special session now because it would be political. But if you think about what we have special sessions for, like a flood or a tornado, okay, just the pool of people who are directly affected by this thing is 250,000 people. That's the population of Rochester, St. Cloud, and Duluth combined. Picture every single person in every single house in those three cities, totally flooded out because that's what's happened. That's the crisis level we're at and how many people are affected. And the governor says, that's a little bit too hot to handle, too political. Let's wait until later, maybe next year. And people right now are really they got their back against the wall and don't have time.
I guess they do, yeah. Against the wall is, I think, putting it mildly.
Well, the four
And this is all
insurers-
unnecessary. If they just left the thing alone, we'd be in better shape than by pushing Obamacare. This is what I keep thinking all the time.
If you could go back in time, if you could have what you had before, would you take it? I think you probably would,
think I probably would, yeah.
even paying what you're paying now, which is more and not less, which is what it was supposed to be.
That's for
I
sure.
mean, I'm lucky. I have some additional coverage from my military service. So I mean, I do really come out really nice on the insurance. I have to admit that, and that's turned out to be one of the most valuable parts of my military service is the medical coverage, and I figured that would probably never amount to be a big benefit that literally the pension would be. Pension's nothing compared to what the medical coverage covers now.
Yeah.
I mean, and I have the Medicare, but I mean, after the Medicare pays, there's still a big chunk, and that military picks it up. That's TRICARE, and I don't know where I'd be without it. If I was in the insurance market, oh my God, I don't know.
Yeah, we'd all be in.
We'd all be in big trouble, or we might not be at all.
Well, we've been going around the state, and I've been having meetings in different counties around the state about what where do we go and what do we
Yeah,
do next and
I
how do we
see.
fix this thing?
Now that we got it, what do we do with it?
Yeah, it's not very hard to point fingers at this thing and say, admire the problem about how bad it is, because it's bad and we're in the soup. But it's not just the people who are paying the premiums or trying to pay the premiums or trying to find the plan. It's the counties that have to administer this mess called MNSure. And it's also the hospitals that are trying to deal with it, and the doctors that are dealing with uncompensated care and trying to get people care, or the people trying in the middle. So when we meet with the counties, they say that, well, we've know who the families are that we need to help. We've been helping them for years. Now everybody's got to go through this MNSure mess. They're trying to deal online with filling out their applications. They can't. They come in, we fill them out by paper, we put them up on the screen, somebody else fills them out, they send them to MNSure, they print them out, somebody else fills them in, and then it may or may not get loaded, and everybody may or may not get in the right slot.
This has a Byzantine look to it.
You might have a
then
card.
hopefully there's no problem, and like what's just happened, a bunch of them have to reapply from scratch again.
Or if, the worst case scenario is the people who are in the basket that think they have care and they don't find out they don't have care until they go to the doctor. And if you go to stopmnsure.org, there's a video of a gentleman with the worst possible outcome you can think of, trying to get his wife insured and get her care, and actually she ended up dying trying to get the care while they had gone through the application process. They had their check cashed by the insurance company. They did everything correctly, but somebody didn't fill out something correctly along the way. Fingers get pointed. She couldn't get in to get the care that she needed. She couldn't get it diagnosed for months. Couldn't get in to get the tests that they needed. By the time she did present in the emergency room, it was too late, and she died. And that is something that we can't have happen again.
Sounds like Canada.
It's
where
horrible.
they go for months before they can get an MRI, and by the time they discover what's wrong, it's too late to treat it.
Yeah, and if you have higher copays and higher deductibles, my wife is an OB doctor, and she counsels women on when they need surgery for different things. And they put off things like imaging, if you need a scan of some kind or another, if that's out of pocket for you and you don't have the money, you might have to wait until next year to do that. And women in her practice are putting off the imaging that they need to find out whether or not they need to have surgery. And that's not good for people either.
No, it's
so
not.
that it's really putting pressure on people who are primarily people in middle-class Minnesota. And they're not protected by a big company or a big union, or they don't work for the government. That's Main Street, Minnesota. That's who's getting squeezed the hardest right now.
Where can we go from here?
Well-
I mean, and I know whatever we come up with here is not, may not be the final solution or whatever. But what are some of the areas that where let's say we have to go in order just to get things working a little better?
Sure. Well, number one, I've got a very, very complicated plan for MNSure. So it's very, very, very complicated.
Would turn it into what it used to be?
No, it's super complicated. It's 2 steps, okay? Step 1 is to kill it, and step 2 is to bury it.
Okay, there you go.
That's 2 steps. That will take care of a large part of the problem, because it is an unnecessary layer of bureaucracy that prohibits doctors and insurers from helping. And those are kind of necessary people if you're going to pay for and care for people.
But it's a guaranteed employment plan. We need that after our recession here a decade ago. keep
No.
people employed.
No, we don't
Make
need
work.
we don't need that. So other states.
It worked great for Roosevelt in the 30s.
Well, maybe if they were building bridges, I would support that. Or building the Como Conservatory. This is actually not just costing money. This is hurting people. This is really hurting people
Really?
by its negligence. And so we really do need to stop that. And you'd say, well, you can't just vote against it. That sounds like you're against things. The states of Oregon and Hawaii, 2 states that are even bluer than Minnesota, they had governors that said, you know what, we made a mistake. We need to go back and we need to correct it. Those 2 states were able to do that. We can do that too. So we need to eliminate MNSure. The next step we need to do is we need to separate the private health insurance in Minnesota based with health insurance carriers and insurance agents that you can know and trust, and our public plans. Currently, they're mixed up in the same soup, and the county folks are doing the job of the insurance companies, and the insurance companies are trying to do the job of the county folks, and it doesn't work. We need to separate those two. Also, we have a data system in Minnesota that actually works. It's stable, it's functional, you can send out invoices and receive money. That county folks know how to use it. It's a legacy system, but it is mainframe, it's stable, it's very secure, and it's fast.
They used it for many years, right?
And it works. And that's what the county folks can and want to use as a bedrock that we can build on top of. That's what works. What also worked was our program that we had for people who were high risk.
Okay, we're getting close to the end of our show, so make sure we
That's
get all
3.
the...
And so now we're getting close, and then we need to offer some more choices for people. We need to allow the insurance companies to come in out of the penalty box that we currently put them in.
Yeah.
We say that you can't write insurance, and we need to open up the market to more products so that people can go back in and middle-class people can afford health
products,
insurance
more
again.
competition.
And we do need to, we're going to have to spend some money to buy down those premiums and get people back into the market. And that can't wait until next year. It has to happen now.
Yeah. Well, I sure wish you luck, because we're all riding on your horse.
Yeah. We got a crisis going. We got to do something about it.
This is real. We need to have solutions.
And it's an unnecessary crisis. It's the classic example of big government meddling and making a mess of things because they're
bureaucracy
following
gone
their
mad.
ideology rather than common sense. That's what it amounts to.
And we've got the best hospitals, doctors, and care providers in the world. We've got the best insurers in the world that are still here.
Yeah.
And all we got to do is connect them back up to their patients. And we still have time, but we have to move really fast.
Yeah. Well, that is enough. That is this is one of the biggest messes I've ever seen government get us into. And I sure hope we can get out of it in time. And with that, I think we're going to have to call it quits. And Lord help us, we don't have to, a lot of people don't have to call it quits. And thank you so much for coming here and giving us this information.
Thanks for having me. I'd love to come back for an update.
Glad to have you, Matt.